everyone, and thank you again, and welcome to the Influent Network. I'm your host, Dr. John Scott, and we have a very, very special guest tonight. I'm honored to have him on. He's a friend of mine that I've known for many years, and fellow anesthesiologist, but he is the president of Texas Medical Board, and wears many, many hats, and it wouldn't be fair for me to try and give his bio because I'm going to have him do it. Please give a warm welcome at home to Dr. Sharif Zaafran, President of Texas Medical Board, good friend and anesthesiologist. Dr. Zaafran, thank you for being on tonight, and please tell us about yourself.
Well, thank you, John, and thank you for inviting me on for your podcast here. It's a pleasure having an opportunity to communicate with a lot of healthcare professionals out there, or would-be healthcare professionals, medical students, and others. Always great to engage with our young folks out there coming up behind us. As you had mentioned, I am an anesthesiologist. I've been practicing for 25 years. Graduated out of UT McGovern here in Houston. Did my studies in undergrad over at UT Austin beforehand, but grew up here in Houston, grew up out in Sugar Land, spent many, many years after my residency involved in organized medicine. As it stands right now, I currently am the president of the Texas Medical Board. I also am on the board of directors of the Federation of State Medical Boards, which is an umbrella organization over all the medical boards in the country. And I serve in my capacity as the National Legislative Liaison for the company that I work for, which is USA Anesthesia Partners. And in that capacity, I also serve as the vice chair of the Clinical Governance Board for our practice here in the Gulf Coast region. On the other organized medicine standpoint, I serve as a delegate to the American Medical Association, the Texas Medical Association, the Texas Society of Anesthesiology, and the American Society of Anesthesiology. So, yeah, wear a lot of hats, but a lot of them kind of intersect with each other. John, you and I know we've done a lot of these things actually together. Whether it's servicing in the regulatory arena at the state level, or whether it's doing it in organized medicine at both the state and the national level.
One of the things is I'd like to ask to go over with a man of your entrepreneur background and who you are and why did you pick medicine? And then specifically, why did you go into anesthesia?
Yeah, so that's an interesting story. Actually, when I was in high school, not to date myself, but that was around the time period of Top Gun being the top movie at the time. And for a while, I actually wanted to be an Air Force pilot, or a Navy pilot, actually. And I had applied to the Naval Academy, got accepted. I was nominated by Congressman Tom DeLay back at that time. And like I said, I wanted to be a fighter pilot, but my eyesight was not 20/20. So they told me I would never be able to be a jet fighter pilot. So I chose instead to go over to UT and do pre-med. It was always a binary choice for me. It was always going to be one or the other. Healthcare was a passion for me. It's something that my mother, as a physician, had always been around her when she was working at the hospitals. And it's something that I thoroughly enjoyed doing. Another part of it was really, to a certain extent, job security. I grew up in the era in the mid-1980s with the oil glut, and a lot of folks, including my father, being laid off in the oil industry. He later on actually started his own business and as an entrepreneur did very well. But just from the standpoint of being in a business sector where job security was something that I wouldn't have to worry about, and at the same time doing something that I thoroughly would enjoy. Before anesthesia specifically, you had asked about anesthesia. When I was in medical school, I actually had a lot of mentors, and it's interesting because my activity in organized medicine when I was in medical school was involved around somebody by the name of Dr. Betty Stevenson. Somebody who was a very, very strong mentor of mine. Dr. Betty Stevenson was an anesthesiologist, and she was also president of the Texas Society of Anesthesiology and the American Society of Anesthesiology at one point. But as a mentor of me becoming involved in organized medicine, I also got attracted to the field of anesthesiology in general, and I ended up going in that direction after medical school.
Very good. Thank you. Just to kind of relate to you, Dr. Zaafran, is when I was just about to graduate from college, I walked through the Center Center, that's our student center, and there was a Marine full dress corporal, and he had a video of a Harrier, and he said, "Do you want to fly that thing?" And I said, I wear glasses." He said, "Oh, as long as they're 20/20 vision with glasses." So I ended up going through all this testing and stuff in Houston, the full thing. And then I took a test that was in top 1% of the nation. And then I started out with corporals, sergeants. Then finally a major came to my house. And I said, "Listen, either you let me fly the thing or I'll go to medical school." So that was interesting. We both had that same passion.
Yep.
What I did about mine is I ended up finally going over to Moscow, went up the MiG-25 Foxback, went up 84,000 feet, Mach 3, and wore a spacesuit. It was a really cool adventure. But anyway, what a great relation we have with each other. What a passion. One thing I'd like to ask you, you tipped on mentors. So what? Is that a big deal or not? Do we need mentors? Why do you need them? And what effect have they had in your career?
Well, I think mentorship is actually really, really important. Not from the standpoint of deciding what you want to go into, but helping create a pathway for the passion that we all have. So whether it be advocacy, making sure that that you kind of go down the right path of which organizations to be involved with, meeting the right people to have those relationships with, and understanding and learning from them. But that's really key. Somebody like Dr. Betty Stevenson or even Dr. Kyle Janik, who, again, one of my former partners, former state rep, state senator, and eventually was commissioner of health and human services at the state level. And then afterwards, he went back to being an anesthesiologist. But helping point out the importance of advocacy and helping chart a path for ourselves as physicians, making sure that in the regulatory arena, that if you're not at the table, that you're, as they always say, on the menu, and making sure that that you are representing not only the views of your profession, but what you believe is the right thing to do. More importantly, representing what's in the interest of your patients. So having those mentors, at least, made sure that you're doing the right thing, involved in the right activities, and kind of charting that long-term pathway of where you see yourself in the next 5 years, 10 years. It's also important, just in your own practice, whether it's in academic practice, if you're going down that pathway, or in business practice, if you're in private practice like I am, helping chart that pathway of how you can grow, how you can learn, how you can best manage the practice itself and delivering care to your patients.
Perfect. That's very good. Kind of leads into my next question is what helped you along the way, and also what setbacks have you had? And the big thing is we all will face adversaries or problems in our career. How have you worked through them and handled them, especially stress and things of that nature?
Well, I guess, the thing that it's always important to be mindful of is to chart your own personal time along with your business time, making sure that you are paying attention to that balance of home and work. A lot of us have families and we have kids, and making sure that you spend time with your family is really, really important. That balance is really key. In some specialties in our profession, you see that the divorce rate is very, very high. You can't be married to your work. There has to be that balance of both work and home. And it doesn't have to be mutually exclusive. It shouldn't have to be one or the other. One of the great things about advocacy and me being involved in different arenas there is that our spouses are very much involved in that also. And when we go out with the friendships that we develop over the years in that arena, our spouses also develop that friendship. So having them also involved in the work that we do is really key and important. It helps create that strong bond that allows you to do a lot of the work that you do, but not necessarily take away from being away from your wife or husband or significant other, along with your kids. Over the years, you are going to obviously have setbacks, but as we always say, nobody moves forward in life without having those setbacks. And the key and the most important thing out of those setbacks is to learn from them. There is no setback, I would say, that should be taken as a negative. If you look at the most successful people, whether it be in our industry or even in other industries, nobody had a straight path upwards. They will all tell you that they've had those setbacks. And the key thing that you learn from all of them is that they've all learned from what they can with those setbacks. They actually learn to be a better person, a better physician, or a better business person. So setbacks is not a negative thing, so long as you actually take it in stride and you learn from them.
Very good. Thank you so much for saying that. And I've had the good fortune to meet both his wife and his children, and they're very good people, very nice people. And thank you for bringing it up about family. Now, before we switch over to the Texas Medical Board, anything else you'd like to say about what experiences you've had in life and anything you'd want to tell the medical students or residents about what helped you get to where you are today?
Yeah, make sure that you always have a life outside of your profession. Pick a hobby and be passionate about that hobby. It turns out that John and I have a common interest in listening to certain types of music. And
tell them what it is.
So we actually kind of both of us like techno music. We always talked about some of the great concerts that happen around the world. One of them is in Miami, Ultra Music Festival. There's others that are out in Nevada or even in different places in Europe. But regardless, whatever other type of hobby that you have, whether it be a sport, whether it be an activity that you enjoy doing, having that life outside of the hospital setting, the OR, the clinic, whatever that might be, is always really key and really important. Making sure that you develop good, strong friendships, having that solid one or two individuals out there that you can lean on if need be. We all go through stressors in life, and making sure that you have that somebody that you can talk to and relay those times when you are under a lot of stress is really, really important. We can talk a little bit later on about one of the things that are very important for us here in the medical board, which is physician wellness, and making sure that as all of us go through the stresses in life, whether it be work stress, the regulatory things that we have to deal with on a daily basis, that we have that ability to unwind. But even more importantly, we have the ability to reach out to someone and seek the help that, we may need when and if we ever do need that. So that's always a key thing for all of you guys out there as young individuals coming up in your profession, is having that life-work balance and having that outlet that you can always utilize if you ever have to.
That's excellent, Dr. Zaafran. Kind of keys up our next topic. We're going to put on your next hat, and that'll be Texas Medical Board President. Please elaborate about what you've done, what you've seen. And at the end of it, I'd like for you to give us some lessons learned, pearls, not what to do, things that I'll ask you as we go along. Please put on that hat and please elaborate. Thank you, sir.
Well, the Texas Medical Board is a state agency that is comprised of 19 board members. All of us are appointed by the governor. There are 12 physicians and 7 public members. To be more specific, the 12 physicians have to be, at least 3 of them have to be DOs, doctors of osteopathy, and the others can be either MDs or DOs. And our job is primarily to protect the public. The things that the medical board is involved in protecting protecting the public is overseeing our licensees through the disciplinary process, the licensure process itself, and the regulatory side of implementing what we call the Medical Practice Act, which here in Texas is the law that governs the practice of medicine. Now, in the medical board, we oversee not just physicians, but there are other healthcare providers that we oversee also. They involve physician assistants, medical radiological technologists, acupuncturists, and a variety of others, radiological assistants. Altogether, it's about 180,000 clinical providers in the state of Texas. About 115,000 of them are physicians directly. I was appointed by the governor back in 2017 to the board, and specifically to become president of the medical board. In my tenure so far, we've gone obviously through a lot of interesting times. One of them being COVID, which was something that all of us as healthcare providers lived through, and to say the least, was certainly an interesting experience that we've all had to go through. There are certain bits of legislation that were passed also during my tenure that we've had to help manage. Representing the regulatory side of medicine is sometimes not easy because you want to make sure that you're protecting the public, but you also want to make sure that you are providing the regulatory environment where our physicians understand what we're holding them accountable to, and making sure that they have that lane to be able to do so in a fashion that allows them that clinical autonomy, but at the same time taking care of patients in a fashion that is acceptable.
Very good. Thank you. Now, tell us if you can, some of the lessons learned, some of the laws that passed and how it affected different people, and some of the controversies that you've had as president.
Well, initially, when I first became president, there was an initial push to go into telemedicine. Back then, telemedicine was very early on in its infrastructure, and as that was being developed state by state at the time, there was a controversy between one company involved in providing telemedicine in the state. That involved a lawsuit between that company and between the medical board itself. That was something that predated me coming onto the board, but I had to be involved in as soon as we got on the board. I remember one of my first experiences about a couple of months after I joined the board was having to go to Washington, D.C. with attorney general lawyers along with our own general counsel attorneys to meet up with the FTC in Washington, D.C., talking about the lawsuit that was going on. Ultimately speaking, that lawsuit was resolved because the state legislature passed legislation that governed how telemedicine would be regulated in Texas, and that essentially superseded pretty much anything that the lawsuit might have involved or rules that were developed by the medical board itself. But it was certainly an interesting experience. You learn to, of course, make sure that as we develop rules and regulations, that it's done in a way that is able to provide the kind of service that we need to provide in the state, which again, telemedicine is key and important, but to do it in a way that still preserves and protects the need for physicians to be able to manage patients in a way that is appropriate. Now, that kind of segued into COVID, where telemedicine was one of the primary means that we could continue to practice medicine. And in fact, a lot of the rules and regulations around telemedicine had to be loosened up around that time. That was one of the ways that one of the only ways that physicians and patients would be able to interact and be able to receive their health care. And managing that process was very interesting. It kind of went full circle from one extreme to the other. And now we are kind of at a steady state where we've got some good long-term rules and regulations around the provision of telemedicine, kind of that happy medium where we want to make sure that that patients and physicians are able to utilize it in a way that's effective, especially as patients are following up their care and are able to receive their medications on a timely basis and not having to travel every single time to see their physician face-to-face, but again, doing so in a manner and a mechanism that is still safe.
That's fantastic. Okay, I want to switch to, let's get a little bit deeper into physicians, their behavior, problems they've gotten into, and things you should avoid, and what happens when you get into those kind of troubles. And if you could elaborate on it, maybe give us some examples of things that have happened and what, as you've seen over those years, and what should we know and what should we do about it?
Yeah, so I guess one of the common themes that I've seen over the years is as business models develop in how to monetize the delivery of care, typically speaking, that involves non-physicians, but there's one valuable thing that they need in order to be able to deliver these products and services, and that's a licensed physician. And what I always emphasize with our licensees is that license that you hold and that you renew every couple of years is a very, very valuable thing that you have to really cherish and protect, and make sure that you don't fall victim for it being utilized in a way that may not be appropriate. And really, there are very simple rules that we always remind our licensees as we do anything that involves the delivery of care, especially new forms of delivery of care. The main thing really is the establishment of a physician-patient relationship in any means of how we deliver that care. That establishment of a physician-patient relationship has some very specific rules around it. A lot of you as medical students, or those of you early in your career, I'm sure will become very, very well aware of it, which is number one, establishing a relationship between you and that patient, making sure that you have consent from that patient for treatment, obtaining a history, and at some point doing somewhat of a physical exam, depending on what it is that you're treating. A lot of the types of delivery of service that we've seen out there that people get into trouble with involves maybe another provider taking an intake of information from a patient and asking a physician to review that information, maybe on a piece of paper, and rendering a diagnosis and maybe even a treatment plan based on that. And where we see physicians getting into a lot of trouble is doing that type of intake, or taking the information from the intake and rendering a diagnosis and a treatment plan without, in our view, having truly established a physician-patient relationship. So that is something that I always tell folks to be very wary of, especially when you're prescribing a product that may be very expensive or may not necessarily be needed by the patient. We've seen folks get into trouble in those instances. The other area where I would always caution our licensees is when you are being asked to delegate the practice of medicine to another individual, or to supervise an individual that you've delegated the practice of medicine to, and making sure that when you do so, that you're following the rules of the Medical Practice Act as it governs delegation and supervision. But the main tenet of that, and the key thing of supervision and delegation, especially in Texas and our rules here, is delegating to an individual that you deem are qualified to do what you have delegated to them to do. And that sounds like a lot of legal jumbo mumbo. When you really break it down, though, it's actually very specific. If you're going to delegate to another individual an element of the practice of medicine, you've got to make sure that the thing that you are delegating to them, that they are qualified to do the thing that you've just delegated to them. And I know it sounds like it's common sense, but it really is another area where we've seen a lot of folks kind of fall into trouble if they're not very careful in upholding that. Making sure that you're appropriately overseeing the individuals that you're delegating to. We've seen here in Texas, if all of you follow the news, areas or arenas, whether it be in hydration clinics or in aesthetic clinics or other types of these entities where patients were harmed. And when these complaints come to the medical board, where potentially an inappropriate amount of oversight has happened. And in those instances, we have to hold the physicians accountable for inappropriate delegation or inappropriate supervision. So those are the kind of things that we always tell our licensees to be careful of. It's okay to be an entrepreneur, but just to be very careful and very cautious when your license is being used in these type of business types of delivery, and to make sure that you're doing so within the constraints of the Medical Practice Act and the law as it's written.
Very good. Thank you. I did want to ask you, before we switch topics, talk about pill mills, drug abuse, alcohol abuse, and our physicians and things. Is it the end of the rope? What happens to you? Tell us a little bit about that, if you don't mind.
Sure. So, obviously one of the things that we are always, making sure that we are wary of and have the kind of oversight that's needed on is looking at the opioid crisis and the effect and the impact it has both on our citizens here in Texas, but also on our licensees and how it can potentially impact them. So that question actually is two different kinds of questions. So I'll kind of address them a little bit differently. There's one component in how we as physicians treat our patients, especially those who may have chronic pain or specifically who might have what we call a substance use disorder. It's very important that these patients be treated appropriately. Now, I know that we as regulators also are very mindful of making sure that patients who are being treated for chronic pain with opioids or just controlled substances in general are done within the regulatory arena and the regulatory environment that we prescribe out there. There are very specific types of rules that have to be followed when you're prescribing controlled substances. I'm not going to go into a lot of detail of what that looks like, but it is important that they be followed. Now, we have seen, because we have oversight on how these things are being prescribed, the nefarious use of prescribing in an inappropriate way. And that's where Dr. Scott was referring to what are called pill mills, where unfortunately you have licensees who are using their license to prescribe inappropriately medications, not for a diagnosis and treatment that's appropriate, but really for folks who are using it for illicit use. And, we look at those individuals and make sure that if there's a pattern of prescribing that looks like it's inappropriate, that we investigate them. We audit their practices. And if we see something that is being done inappropriately, we may actually restrict or suspend their licenses completely. And that has happened. Now, the other part of that is also making sure that chronic pain patients are not limited in their need for appropriately having their chronic pain managed. We have seen some patients not receive the kind of care that they need. And what I've stressed in many, many instances is the caution that I have of our patients being pushed from the regulated environment into the unregulated environment. The unregulated environment are patients who feel like they're not able to get the medications that they feel that they need. And then going out into an unregulated arena and looking for those medications in that unregulated arena, whether it be from the streets or looking at getting it from other countries or whatever that might be. And unfortunately, what we've seen is that these medications are typically not what they are advertised to be. Some people may be looking at purchasing something like oxycodone, which when you mix with Tylenol is called Percocet, buying it off the street that way. But unfortunately, these things are not pure, and they may be laced with medications like fentanyl. And when taken, not understanding that they may be mixed with these types of medications, it may cause things like respiratory depression, where you stop breathing, and causes a person to have a sentinel event. When you look at the opioid overdose or overdoses in Texas, and really in most of the country, you find that the vast majority of them are in that unregulated environment. And that's why when we talk to our physicians, even if they see a patient using medication inappropriately, if they have a substance use disorder or an opioid use disorder, we want to make sure that those patients are not pushed from a regulated environment into an unregulated environment. They need to continue on being treated, but they need to be treated appropriately. They may need to have behavioral therapists help take care of them. They may need to have a psychiatrist take care of them. They may need to just have the right folks take care of them, but they need to be taken care of and not pushed into that unregulated environment. The other side of your question was actually about physicians themselves who may have a substance use disorder, whether it be alcohol or whether it be illicit drugs. We have a program in Texas which actually applies not only to our licensees but also to medical students. It's called the Physician Health Program, PHP. And the purpose of the PHP is to actually help our licensees when they have these types of issues, whether they be substance use disorders or if somebody's going through a certain struggle in life, a psychiatric struggle or any type of behavioral disorder where they may be struggling in general. The purpose of the PHP is twofold. Number one, a licensee or a medical student can self-report to the PHP program and get the help that they need that way. The value in being able to do so is that you are actually protected from the Texas Medical Board if you self-report and if you follow the recommendations of the physician health program. That allows the person to get the help that they need. And if they do so, for it to be done in a way where they don't have to worry about reporting or being reported to the Texas Medical Board, where action on them may be taken that goes beyond just the treatment that they need. It may be something that may be made public, and it's obviously something that they would obviously want to be able to avoid if they can. If things come to the medical board directly, if we get a complaint to the medical board directly about somebody who's struggling like that, we from the medical board can also refer somebody to the PHP program. The difference being is that we have oversight over them at that point, and it may potentially be reported in the public arena. But still, it's something that if the PHP program says that these folks have gone through the process and in their opinion are safe, then we can continue to allow them to practice. Or we can continue to allow them to practice while they're going through that oversight, whether it's having spot treatments or checks throughout that process. So in both instances, it's a way to make sure that our licensees are able to be taken care of themselves directly, while also being able to take care of patients. At the end of the day, our ultimate responsibility is to our patients. We want to make sure that the patients that are being treated are safe. And then secondarily, but as importantly, making sure that our licensees are getting the help that they need and able to still practice if at all possible.
That's excellent, Dr. Zaafran.
Another thing I would add to that, John, is the legislature just recently passed in 2023 legislation that increased our license fees by about $15 per licensee every 2 years. And that money allows the licensees who have to enter into the PHP program to be able to do so free of charge. So as these physicians are going through the stress of whether it be a psychiatric disorder, a behavioral disorder, a substance use disorder, whatever it might be, and if they're not able to practice or they're having financial difficulties at the time, this allows for all of them to get the treatment that they need and not have to worry about paying for it at the time.
That's an excellent thing. I appreciate you doing that. I appreciate you sharing it. We don't have too much time left, but I do want a few minutes, take off your TMB hat and put on your advocacy hat. One of the things that I'm told is, why get involved? Why do we need to do this? Who cares? I just want to take care of my patients, go home to my family. Why do I need to be involved in political things?
Please, that.
Sure.
Yeah, so, that's an excellent question. And the easiest answer to that is that in this arena, laws and regulations are going to be passed whether we're involved or not. Rules around how patients are going to be taken care of are always going to be written. And nobody knows and understands how important it is and what type of regulations are needed in helping take care of our patients more than us, who are the ones taking care of our patients. And what I tell folks is that if we're not the ones helping write those regulations, pass those laws, advocate for our patients, in the absence of us doing it, somebody else will. And chances are, if it's not us doing it and somebody else is doing it, it's usually going to be somebody who may not be the best advocate for our patients, especially in the practice of medicine, in writing those rules and writing those regulations and in passing those laws. It goes back to a comment I made at the very beginning, where if you don't have a seat at the table, you're going to be on the menu. You're going to be on the receiving ends of rules and regulations where you're going to look at it and say, this really doesn't make any sense. It doesn't help in how I can deliver care to my patients. It doesn't help in that patient receiving the appropriate care that they need. And my answer always is, if you weren't there to help write those rules, to write those laws, to advocate for your patient, then it's really going to be very hard for you to complain about it, because it was going to be up to you to make sure that you are in that room with regulators who really are regulators. They may not be the experts in how to deliver care to our patients. They don't have a medical degree behind their name. or a doctor of osteopathy degree behind their name, and may not be the best ones to write those rules. So again, you're the best advocate for your patients, and it is in the interest of your patients and of our profession to be the one sitting at that table helping write those rules. And that's where advocacy comes in.
But what if I'm a Democrat and the guy's a Republican, the legislator is a Republican, or if I'm a Republican and the legislator is a Democrat, I just don't want to get involved. Why would I do that?
Yeah. So, the patients that we treat are neither Republicans or Democrats. Diabetes is not Republican or Democrat. Hypertension is not Republican or Democrat. As I've always told my colleagues that I always talk to about advocacy, is that healthcare, the delivery of care, is agnostic to party. Now, yes, I understand that there may be differences in how we pay for things and, what we think should be compensated, et cetera, et cetera. And yes, there are some nuances there. But in general, our patients and how we deliver care really should be agnostic to party. And it's important for us to engage both Republicans, Democrats, whoever they may be, regulators in general, and talk about taking care of our patients, which really does not see at that time being a Republican, being a Democrat, being a partisan in general. So from my standpoint, when I'm an advocate for my patients, I take my partisan hat off, whatever that partisan hat may be. And I'm just thinking about what is best for my patient. What can I do to make sure that my patient gets the care that they deserve and that they need? What do I need to do to make sure that the drugs that they receive are affordable, that the insurance companies that are paying for that care are doing so in a fair basis? What are the rules and the regulations and the hoops that our patients have to go through in order to be able to receive and deliver that care? Those are the kind of things that I think about, which, like I said, and as you know, John, it's really agnostic to party. Delivery of healthcare in general. Like I said, it may have its partisan nuances, but at the end of the day, it's about taking care of that sick patient that really needs our care.
That was really, really good. I really appreciate you breaking it down. And I really want our audience to know that it's so important to get involved. It's so important you're in medical school, and I understand you're studying real hard, you're a resident, you're studying real hard. But if you do not get involved, the laws will affect you. So you are the advocate and you are the expert. So if you don't get involved, you won't have an opportunity to make a change. Dr. Zaafran, you've been wonderful. Is there anything before I have my closing remarks you'd like to leave with us? You have been a whirlwind of information. What a wealth of knowledge you have. We really appreciate you.
Thank you, John. Really the one thing I would say is, and I hear this from many, not only medical students, but from physicians in general, is that I'm one person. What can I do? It's a behemoth, complicated regulatory environment out there. And I'll really break it down to you. And I'm gonna break it down from the standpoint of someone who's done this, but also talking to John here, who's also done this himself. When you're talking to a congressman or woman, a legislator, about something that affects your care for your patient, they look at you as the expert, as the one that is really the person who understands the nuances of delivering care. There's not a person out there, no matter how high they are or how low they are, whether it be the president of the United States or whether it be a homeless person who's struggling to survive on a day-by-day basis. But every single one of them at some point is going to have a doctor taking care of them. And you are really the common denominator who can go and speak for the president, the homeless person, or the regular neighbor out there that needs delivery of care. So you carry a tremendous amount of weight in advocating in that delivery of healthcare. And I would never, ever belittle what you do. And you should not belittle what you do. We are sometimes our fiercest critics. And what I would tell you is when you go out there and you're wearing that white coat and speaking to either a regulator or to somebody who's going to be passing a law that affects the delivery of care, you are going to be looked at that expert in the room. You are going to be looked at with a tremendous amount of respect, and you will be listened to, and your words will mean a lot. So don't abdicate that responsibility. Actually embrace it and go out there and be the advocate for your patient and for your profession. it's really important because, again, as I said earlier, if it's not you, it's going to be somebody else. And chances are that somebody else is probably not going to be the right person with the right qualifications and the right background and the right education to advocate for what is right in the delivery of care for those who are the most vulnerable, your patients who are out there.
That was excellent, Dr. Zaafran. I can't thank you enough for taking the time out of your busy schedule. You can see how busy that he is. And I really appreciate your wealth of knowledge and really your expertise in helping the students and residents understand this thing. I think it's a great honor to have you, and I hope you'll come back and be on our show again. Also in the future, we're going to have the president of Texas Medical Association, the president of the American Society of Anesthesiology, as well as the secretaries, treasurers. I'm going to have the CFO of Southwest Airlines, the president of Amergy Bank, because I want you guys, all of you, to understand that business is involved in medicine as well, and you have to survive. So we take the wealth of knowledge of Dr. Zaafran tonight, and we're going to express it, and we'll have him come back, and I'll also get some questions to him as well as for when we have him again. We really appreciate your time, Dr. Zaafran, and appreciate your wealth of knowledge. And thank you again so much for being on the show tonight. And thank you all, and good night to all of you.
Thank you, John.